I'd like to introduce you to Dr. Ashok Rai. Thank you. Good job, man.
Thank you, Don, and thank you for your extraordinary service and the hardest time for our organization. I'd also like to extend a very special thank you to Dr. Rob Nessie of the Mayo Clinic. Rob stepped up well beyond his time on the board and helped us out this summer by chairing our National Search Committee, and Rob, we're very appreciative of all of your work. As one of my first honors as chair, I'd like to officially recognize your 2018 Executive Committee. I know this is a thoughtful, innovative group that's already taken the ball and running full speed into the future. The entire 2018 AMGA board is the A-team of healthcare, and I really want to extend a special welcome to our new 4 directors, Dr. Beth Averbeck of Health Partners Care Group, Dr. Mark Briesacker of Intermountain Healthcare, Dr. Scott Hines of Crystal Run Healthcare, and Dr. Karen Weiner of Oregon Medical Group. Welcome. It truly is an honor to stand here today, not only as the board chair of AMGA, but as a physician and a person who is passionate, like all of you, about healthcare here in the United States of America. I'd like to begin by thanking my Prevea health team and the board of directors who are all here today and have supported me in this role. I'd also like to thank my fellow AMGA board members who inspire me on a daily basis. And more importantly, I'd like to thank my wonderful wife, Brooke, and our children for their patience and support during this busy time in my career. There's someone else I'd like to recognize, and that is my dear friend, Don Fisher. He's truly one of the main reasons I stand before you in this role today. I had known Don since becoming a member of AMGA and was fortunate, as many, to call him a mentor, a role model, and a friend. He used to pull me aside and say, Ashok, I don't care about my age. I don't care about the cancer diagnosis I've been given. I have no desire to step down from my role as the leader of this organization. This is the most fun time in healthcare. And do you know why? Because this is a time we can truly change. I miss my friend. And today, in honor of Don, I want to continue that conversation about change. Because change in the American healthcare system is needed now more than ever. And we don't just need incremental change. We need revolutionary change. I strongly believe that the power to make that revolutionary change sits right here, in all of you, in this very room today. But if we're going to change successfully, we need to take a hard and honest look at why it is that we're failing. So here are some examples of our need for change and how our fellow members are actually leading the path. I want to start by addressing our addiction to the fee-for-service methodology of payment for healthcare in this country, because I think it's what we should be most embarrassed of. Because you know what we ultimately end up doing when we operate in a fee-for-service environment? We benefit financially when very bad things happen to very good people. I want you to think about how many times someone has confronted you with a clinic dashboard or a hospital dashboard, worried that there is a number in the red because you haven't performed enough procedures. Take cardiothoracic surgery, for example. Say the hospital has a goal of 20 open heart surgeries a month. Should we really be upset that we didn't reach that number? Because instead of having to cut a patient's chest open, we were able to manage their cholesterol better or use a minimally invasive technique, one that would get them back to their lives, their families sooner. The fee-for-service payment system results in us seeing patients as numbers, and sometimes as dollar signs, rather than people. And this is something we, all of us sitting in this room today, must change. As physicians who went to medical school to help people and who took the Hippocratic Oath, it is our responsibility to change this. We have to challenge ourselves in the exam room, in community conversations, and more importantly, in our very own boardrooms about what it is we're put on earth here to do. If it's about filling a hospital bed, if it's about hoping every morning that when you wake up the dashboard is going to be in the green, then we have a real problem as a profession. Let's celebrate and encourage a healthier America, not a sicker America. But let's remind ourselves, and we see it here every day, that health can be addicting too. Look at the number of people in this country spending money every day on products in a mission to get healthy. And we as clinicians know that some of these health items or products are worth it, and some are just snake oil. We need to do a better job of guiding America in their desires to be healthier. Being healthy is good, a healthy America is good for all of us, and we can still profit from a healthy America. As clinicians, we need to change our research focus and our practice focus. And as administrators, we need to change our financial focus to lead to a healthier America. This isn't about affecting the bottom line. It's changing how we get to that bottom line by investing in value, by taking risk, being accountable for the health of our community, and by understanding that Americans truly want to be healthier. It's time to get on the road to value, to truly becoming the high-performing healthcare systems we strive to be. And we don't have to be on this journey alone. We don't have to start from ground zero, because there's organizations like Kaiser, Intermountain, Geisinger, and Sharp, and so many more that sit in this very room who've already made the change, who have pivoted and taken a risk to make their patients healthier. In addition to adopting a value-based healthcare model, we need to start attacking the origins of poor health of this country. The problem is this: people are shouting from the rooftops that there is a need for healthcare reform, yet nothing's being done to address why Americans are so unhealthy in the first place. If you take a look at this cartoon on the screen here, it may make you laugh for a little bit. Last year, the CDC revealed troubling new findings that just over 70% of all Americans are either overweight or obese. And people like John up here are beginning to think that this is normal and healthy. Now, while John needs to take responsibility for his lifestyle choices, our government is also to blame for the abundance of fat, sugar, and calorie-laden foods being served up to Americans on a daily basis. Our government plays a major role in the production, regulation, research, innovation, and economics of our food supply. And research shows that the government is continuously funneling money into the exact foods that it's telling us to avoid. How many more people need to die before we take serious action and change this? We need to have a real conversation about what's really best for the American diet, one that's evidence-based and not one that's driven by money and greed. There's some wonderful examples of multi-specialty groups already having these conversations and finding success as a result of their own research. In Wausau, Wisconsin, Aspirus has done some great work in researching the effectiveness of a physician-supervised diet program on the total cost of care. This example and many others within this room once again serve as a reminder that the power to change, the power to fix what is broken, lies within all of us here today. Another great example of a healthcare organization leading change is reflected in the Gunderson Health System based in La Crosse, Wisconsin. And yeah, for those of you keeping score, that's my second Wisconsin example. Gunderson has led the way in advanced care planning with this internationally recognized program called Respecting Choices. It is helping Americans and communities across the world that have adopted this model of care to answer two very important questions. How do I want to live? And how do I want to die? This is a program that is enhancing patient care, improving population health, and reducing healthcare costs. And it serves as a good reminder for all of us that we need to do a better job in the exam room, engaging our patients and talking to them, not just about diet and exercise, but about the life they want to live and how we can help them get there. Research shows that a significant, often unnecessary amount of Medicare dollars are spent in the last 6 months of a person's life. We have the power to change that. We just have to be willing to have those difficult conversations with our patients in the exam room to help them live the way they want and die the way they want to. The last but certainly not least problem with our country's healthcare system is this: we continue to allow those who have never sat at the bedside to determine how we provide care. I'm talking about congressmen, senators, and even the president. I'm talking about Amazon, JP Morgan, and Berkshire Hathaway. Can someone explain to me how this is happening and why we as a medical profession are allowing it to happen? It is because we ourselves have not embraced change. We know our system is broken, and because we're not at the forefront of change, we've allowed others to step in front. I'll never forget the time I was at a conference in San Francisco years back. There was a short presentation about the benefits of placing primary care clinics directly into manufacturing environments. The presentation ended up inspiring me to do the same with our company, but the presentation also left me feeling angry. And here's why. The person who was delivering the presentation was someone employed by a company called Quad Graphics. It's a printing company. I was angry because it took a printing company to inspire me to do my job better. Because at the end of the day, we in the medical profession should be the ones leading the change, not printing companies, not financial experts, and certainly not retail giants. I want to close by saying this. While the healthcare system in America is plagued with problems, there is no question that what we do in the medical profession day in and day out impacts lives for the better. We relieve people's suffering, we keep them moving, we keep them alive. We have so much to be proud of, but I hope you can agree that we can all be doing better for our patients, for our country, and for ourselves. Mahatma Gandhi is often paraphrased as saying, "Be the change you wish to see in the world." It is time for us to be the change that we wish to see in healthcare. It won't be easy, but the ways in which we do it won't be difficult to find. All you have to do is look around you right now, right here in this room. Because once again, I strongly believe that the power to change, the inspiration for new ideas, and the key to better healthcare for all of America lies in all of you, the AMGA membership. Thank you.